Katie Swafford with the MD News Network. We're here in the windy city of Chicago at the AMA, CMA, BMA International Conference on Physician Health 2010, talking to doctors about physician health and resiliency in the 21st century. Here's what they had to say.
The difference between practicing medicine in Spain with respect to other countries, I think is the same. I think the needs of the patients or the needs of the physicians are the same in all of the countries. Perhaps change the culture, but the illnesses are the same, and the background is the same. So I think it's not too much difference. Perhaps in Spain we take into account the family values and the living the life with a more relaxed way. So perhaps it can influence.
What little I know about sort of the healthcare systems and reimbursements are very different, and I think that the United States can learn from other healthcare systems in terms of helping to prioritize what's reimbursed, and also I get a sense that as a U.S. physicians, I look at the Canadian physicians and even British physicians, and I'm sure that they have their problems that I don't personally know about, but it seems like from the outside looking in that there's a lot more support for the lives of and the personal lives of physicians and that work-life balance than I think that there is in the United States. I think we have a much more hard work culture here in the U.S. and there's just a lot of expectation to just keep working, and vacations are almost frowned upon, or physicians who have their own practices are hard on themselves because they feel like they just need to keep going, and that somehow they'll disappoint their patients if they actually take a breather. Even though they won't, that will actually energize them, and they'll be that much better to be there for their patients emotionally and other ways, energetically, and really be able to connect and engage with patients rather than being drained and burned out.
I have an opportunity to come to the United States quite often, and I'm often quite surprised by some of the assumptions and misunderstandings about the Canadian healthcare system. I think we've built something very special in Canada that often is called communistic, socialistic, things that have charged emotional values to them. Whereas I don't really think we see it that way at all. I think we see it that, we are a nation of people who have chosen to support each other, to take care of the most vulnerable, to build communities that are truly communities. And I think there is a shared Canadian value that by taking care of the vulnerable, we make life better for us all. I'm not saying it's a perfect solution, and I'm certainly not going to suggest that our system is perfect and the best model for the rest of the world, but it is a system that has served us extremely well. I'm not afraid I'm going to get shot in my community. I know that my children are going to have access to excellent publicly funded education. I know that when I'm sick, there are going to be qualified healthcare professionals to take care of me, and I'm not going to lose my house. So I have a lot of respect for the American people and some of the things that they are currently engaged in debating with as they look at their own notions of what is community, how do they take care of each other, particularly during times of great vulnerability. As a child psychiatrist, as a physician, as a father, I have to admit I struggle to understand why the people of the United States would choose to have millions of children without adequate healthcare coverage. I don't understand that, but I'm an outsider looking in. I think the British system proposes a number of things that are important for us to look at. They have a blend of private and publicly funded services, which is an interesting model. Certainly in my own country, we are reaching a point in time that our dedication to healthcare services covers well over half of our gross productivity, and we need to look at alternative solutions, and perhaps a blend like the British system may have some answers for us. But I think the reality is no one country has figured this one out, and the more we work together and share best practices with each other, the better. But at the end of the day, I think what's most important is the values we use to dictate the solutions that we choose to invest in, and really what does it mean to take care of each other and build a healthy community? It's a powerful question.
My observation is in some of those countries where you have a more socialized medicine system, the pressures are very different, whereas here, with our system as it is right now, there are still a lot of financial dollar pressures that the physicians feel. I would say you would have to talk to the physicians from the other countries, but our system is really in such a state of flux right now. The physicians are really stressed by that.
The United States is undergoing more immediate transition. We're sort of in the twilight zone between the old normal and the new normal. Other countries have had changes in healthcare and changes in reimbursement for physicians and autonomy of physicians in place longer. I'm not saying they've got an easier course of it, simply that we've got more scatter among the overall physician cohort. Some people are still clinging to their little pocket of autonomous practice. Others are well ahead of the curve of building collaborative alliances. And I think that in general, we have a less cohesive medical family, if you will, in the United States.
The difference between the two countries, it's hard to see that there's a lot. I'm sure the way we're paid in Canada and the way that we're paid in the United States it appears different, and I'm sure that has a big influence. But I'd say the actual practice of medicine, the care that we do, is very, very similar.
Now that you've heard the conference attendees' opinions, we want to know what you think. Click on Share Your Perspective at mdnews.com.